I'm still not totally clear on what that means for this guy.
Remember, it just means his heart is beating really fast.
Yeah.
And it's coming from that natural pacemaker in the heart. So basically, it's like his heart is trying to rev the engine, to compensate for that blood loss and keep his blood pressure up.
Makes sense. Oh, and there was that question about his medication too, right? The Ativan?
Yeah, important to know what meds someone's on.
Head east toward Long Lake Road, Greater Sudbury Regional Road 80 South.
Used for anxiety.
Anchor Inn Hotel may be closed today.
Paramedics would need to keep that in mind.
Absolutely.
Yeah.
And then that last question about the tourniquet. Why it's a last resort for stopping bleeding.
Right, we talked about that, but why are they so risky?
Well, because you're completely cutting off the blood supply to that limb. So yeah, it can stop the bleeding, but it can also damage the tissue. And all those toxins build up in that area where there's no blood flow.
Yeah.
So when you finally release the tourniquet, they can flood back into the body.
In 50 meters, turn right onto Long Lake Road, Greater Sudbury Regional Road 80 South. Turn right onto Long Lake Road, Greater Sudbury Regional Road 80 South.
Okay, yeah, that one was interesting.
Continue on Greater Sudbury Regional Road 80 South for 1.5 kilometers.
Paramedics would be thinking about based on the mechanism of the injury. Like, how would the impact itself suggest she's already in shock?
I mean, hitting a moose at speed, that's a lot of force.
Exactly, and that force can cause all sorts of internal injuries that you might not see right away.
So even if her external injuries seem minor, she could be bleeding internally.
And remember, she was pale, sweating. Those are signs her body was already trying to compensate.
Right. The next question was about how much blood she might have lost based on what they saw.
Taking everything into account, the bleeding, the leg trauma, those weak pulses, the textbook estimates she lost somewhere between 1,500 and 2,000 milliliters of blood.
That's a lot.
It is, especially considering pregnant women have more blood volume to begin with. So even though she might not be showing those typical signs of shock,
Her body's definitely stressed.
definitely. Oh, and the textbook mentioned a possible ankle fracture too.
Right.
Important because fractures, especially pelvic fractures, can cause a lot of internal bleeding. Then there was the question about why those signs of shock might be delayed in a pregnant patient.
We talked about that a little, right? Something about the extra blood volume.
Right. It's like a safety mark.
In 600 meters, take the Ontario 17 West ramp to Sault Ste. Marie.
The textbook says a pregnant woman can lose up to 30-35% of her blood volume before you see those classic signs of shock.
Wow, that's a big difference.
Big difference. So you have to be extra careful with pregnant trauma patients. You can't just rely on the usual signs.
Take the Ontario 17 West ramp.
20% of the blood flow gets shunted away from the uterus.
To help compensate, right? But what does that mean for the baby?
It means the mom's body's
In 800 meters, merge onto Trans-Canada Highway, Ontario 17.
protected mechanism, but yeah, it can put the fetus at risk.
So they're both in danger.
It's a tough situation. The textbook also asked about the vasoconstriction. Remember that?
Vaguely. Remind me what that is again?
It's when the blood vessels narrow. It's actually a good thing at first. Helps shunt blood to the vital organs. But if it goes on too long, it can actually make things worse.
How so?
Well, it cuts off blood flow to the extremities. And in this case, it's probably because of those fight or flight hormones, catecholamines.
Adrenaline.
Exactly. Essential in a crisis. But that prolonged
Continue on Ontario 17 for 65 kilometers.
tissues don't get the oxygen and nutrients they need.
Like clamping down on a hose. Stops the leak, but nothing gets through.
Perfect analogy. There was also that question about medications that are contraindicated during pregnancy.
Meaning they're not safe to use.
Right. Always important to consider a patient's medical history and medications, especially when they're pregnant. The textbook specifically mentioned folic acid and vitamin B complex as safe options.
So if she was on other meds, the paramedics would have to be really careful.
Absolutely. Got to weigh those risks and benefits. Then there was a question about her vital signs.
Right, what were those telling us?
Those weak pulses, the confusion, the paleness, all signs of shock. And finally, they asked about the specific type of shock she was experiencing.
Oh, right, there are different kinds, aren't there?
Yet based on how much blood loss there is and how the body's responding. In this case, with that estimated blood loss of 30-35%, the textbook suggests she's in class 3, maybe even bordering on a class 4 shock.
Okay, so remind me, what do those classes mean again?
Class 3 means significant blood loss, rapid heart rate, changes in mental state. Class 4, that's even worse. Dangerously low blood pressure, real threat to life.
She's in a bad spot.
Yeah, she is. That's why they need to act fast. Get her stabilized. Stop that bleeding.
These cases really highlight how much is going on beneath the surface. You know, it's easy to focus on the obvious injuries, but there's so much more happening inside the body.
And that's what we're trying to do here, right? Peel back those layers, understand how the body responds in these extreme situations.
It's all about connecting those dots.
Exactly. Now let's turn things over to you, the listener. Imagine you're the first responder at one of these
Waste
scenes.
$200 in gas to get there.
What would you do first?
What would you be looking for to figure out how serious it is?
Think about what we've talked about today. Those signs and symptoms of shock, the different stages, how important it is to act quickly.
Makes you think, right? All those things to consider. It can feel overwhelming.
Yeah, but I think the big takeaway here is awareness.
Yeah.
You know, recognizing those signs, understanding the stages, that's what matters.
And knowing what to do. It's about being prepared, not panicking.
Right. And this deep dive, this is just the beginning.
There are so many resources out there. First aid courses, online stuff.
Even just reading more about trauma.
Exactly. Knowledge is power in these situations.
And sometimes it really is the little things that make a difference, like just stopping the bleeding, keeping the person warm, making sure they know they're not alone. Those things can buy precious time.
So as we wrap up this deep dive into trauma emergencies, we want to leave you with this. Be curious, you know? Don't shy away from these topics.
The more you know, the more prepared you'll be to handle whatever comes your way.
And you never know. Maybe someday that knowledge will help you save a life.
Maybe you'll be that calm voice someone needs in a crisis.
Until next time, stay curious and stay safe.
All right, buckle up for this deep dive because we're jumping right into the action.
Oh, going right in?
Right into it. You are an EMT
Okay.
responding to a remote accident in northern Quebec.
Uh-oh.
And we're talking remote, like hospital is a distant prayer,
Yeah.
and the terrain itself is like an obstacle course.
Sounds challenging.
Challenging is an understatement.
Okay.
So imagine this. You arrive on scene, frantic, 35-year-old guy waving you down.
All right.
It's his dad. His dad was driving their truck when it rolled down a hill.
Oh, no.
Now, the dad is trapped inside this wreckage.
Okay.
You get to the overturned vehicle and find the patient, a 66-year-old male,
Okay.
lying a good 10 feet away from the truck.
Oh, wow.
Seems he was ejected during the rollover.
Wow.
He's on his back, still wearing his helmet, conscious, but definitely not looking good.
So when you say ejected, does that mean he wasn't wearing a seatbelt?
You know, we don't have that information from the report, so we can't assume either way.
Fair enough.
But just the fact that he was thrown that far from the vehicle.
Yeah, that's a lot of force.
Exactly. Where do you even begin with a situation like this?
Well, the fact that he was ejected from the vehicle is a major red flag right off the bat. You have to think about the forces involved in a rollover.
Oh, yeah.
So we need to be prepared for some serious blunt force trauma, possible spinal injuries,
Right.
and honestly, a whole host of other potential problems. That initial scene assessment is absolutely critical here.
So you start your initial assessment, and things seem pretty serious right away.
Okay.
The patient is lethargic and a little confused, which
No,
not a good sign.
not at all.
Breathing, thankfully,
Right.
which is a plus.
Good.
And it seems regular, strong,
Right.
but his pulse, weak and slow. You can feel radial pulses, so there's some circulation, but something's definitely off.
Yeah.
He's also complaining of pain in his abdomen and groin.
Okay.
And you notice he's incontinent of urine.
Oh, that adds another layer of concern.
It really does. What's going through your mind at this point?
Honestly, that altered mental status combined with the weak and slow pulse, that is incredibly worrying.
Yeah.
This could indicate shock, potentially from internal bleeding,
Right.
something we always have to consider in a trauma like this. And the incontinence
Yeah.
that points towards possible pelvic injuries, adding to the urgency of the situation.
As you're working on the patient, his son tells you that his father takes a daily aspirin,
Okay.
ASA, as it's sometimes called,
Right.
along with morphine for pain
Okay.
and tenormin, a beta blocker for high blood pressure.
Okay.
He also mentions his dad has a history of hypertension,
Okay.
had a heart attack 6 years ago, and experiences angina, which is basically chest pain caused by reduced blood flow to the heart.
Right.
On top of all that, he has diet-controlled diabetes.
Oh, wow.
He did have breakfast this morning, but the son doesn't know of any other medications his dad might have taken.
Okay.
How does all of this medical history change your approach?
Well, it's like adding pieces to a puzzle, right?
Yeah.
And suddenly the picture becomes much more complicated.
Right.
These pre-existing conditions just add another layer of challenges to his care. For example, the diabetes can delay healing
Right.
and make him more susceptible to infections.
Oh, wow.
And his heart history.
Yeah.
That definitely raises concerns about his cardiovascular system's ability to cope with the stress of this trauma.
So you move on to a more detailed physical examination, trying to get a clear picture of his injuries.
Okay.
His airway seems clear and his breathing is good,
Good.
but he's got some pain in his lower ribs, and you notice some bruising there too.
All right.
Then you check his abdomen, find it's distended and tender to the touch.
Okay.
You also notice that his pelvis feels unstable,
Uh-oh.
which makes you really worried about potential fractures.
A distended and tender abdomen coupled with an unstable pelvis
Yeah.
definitely screams internal bleeding and possible fractures.
Oh, wow.
At this point, spinal immobilization becomes paramount.
Right. We need to minimize any movement that could worsen a potential spinal cord injury.
His vitals paint a pretty grim picture.
Right.
His blood pressure is 80/60, his pulse is still weak, and his respirations are shallow.
Okay.
His skin is pale and clammy. It definitely seems like shock is setting in.
Those vital signs are like flashing red alert.
Yeah.
We need to establish IV access immediately.
Okay.
And start fluid resuscitation.
And for those who don't know, fluid resuscitation means.
Oh, good point. So that usually involves using normal saline or lactated ringers,
Right.
which are basically solutions that help restore fluid volume in his bloodstream
Right.
and boost his blood pressure. It's like jump-starting his circulatory system.
Now, I want you to put yourself in the EMT shoes here.
Right.
We've got this patient,
Okay.
66-year-old male,
Okay.
history of heart problems and diabetes.
Yeah.
Clearly been through a traumatic event. Given everything you've seen and heard so far, what other injuries or complications are on your radar? Well, given the mechanism of the accident, we absolutely have to consider a fractured pelvis
Yeah.
and a fractured arm.
Okay.
Given his abdominal pain and distension, injuries to his spleen or liver are major concerns.
Right.
Both are highly vascular organs, meaning they have a rich blood supply,
Right.
and damage to either could cause life-threatening bleeding. And considering his altered mental status, we can't rule out a possible spinal fracture or dislocation either.
But amidst all this bad news, there's one detail in the patient's chart that kind of stands out.
Okay.
His EKG shows a normal sinus rhythm. What does that tell us?
That's actually a bit of good news.
Yeah.
It means his heart, despite all the trauma and his existing heart conditions, is currently beating with a regular rhythm.
Oh, okay.
This helps rule out some immediate cardiac complications, which is a relief considering everything else we're dealing with.
Okay, so we're dealing with a critically injured patient, complex medical history,
Yes,
miles from the nearest hospital, and time is of the essence.
it is.
What happens next?
Well, that's where things get even more interesting and challenging.
We're back, and the situation is pretty intense.
It is.
We have our patient, 66 years old,
Okay.
history of heart problems and diabetes,
Right.
lying here after being ejected from a truck that rolled down a hill.
Yeah.
He's showing signs of shock,
Right.
likely due to internal bleeding, and we're still miles from the nearest hospital. So let's talk about how you, as the EMT, would stabilize and prepare this patient for transport, knowing that you have limited resources.
You're right. This is where the rubber meets the road.
Yeah,
And your skills as an EMT are really put to the test.
for sure.
First things first.
Yeah,
Given the potential for spinal injuries,
right.
careful spinal immobilization is absolutely crucial.
Okay.
That means applying a cervical collar to stabilize his neck
Okay.
and securing him to a backboard to prevent any further movement of his spine. We have to minimize the risk of making a spinal injury worse, especially since we're dealing with a possible fracture or dislocation here.
Makes sense. What about his airway? Should we be concerned about that?
Well,
Even though he seems to be breathing okay right now?
While his airway seems clear at the moment, we can't afford to be complacent.
Right.
His level of consciousness is fluctuating,
Yeah.
and with trauma patients, there's always a risk that his airway could become compromised.
Oh, okay.
So supplemental oxygen is a must. We want to make sure his blood oxygen levels stay up.
Okay, so oxygen is on, and we know he's hypotensive,
Right.
which you mentioned earlier is a major concern.
Yes.
What do we do to address that dangerously low blood pressure?
We need to get fluids into him,
Okay.
and fast.
Right.
2 large bore 5B lines are crucial.
Okay.
This allows us to deliver fluids quickly and efficiently.
Right.
We'll start aggressive fluid resuscitation with either normal saline or lactated Ringer solution.
Right. And you might be wondering what those are. Well, they're basically solutions that help restore the fluid volume in his bloodstream and boost his blood pressure. It's like jump-starting his circulatory system.
Exactly.
And while we're doing all this, how do we approach pain management? I can't imagine how much pain he must be in.
Pain management in trauma is always a balancing act.
Right.
We want to alleviate his suffering, but we don't want to mask any symptoms that might be crucial for assessing his condition.
Right.
Remember, his son mentioned he takes morphine regularly for pain.
Yeah.
That means we have to consider his tolerance to opioids.
So do we give him more morphine, or is that too risky given his current state?
It's a judgment call, and in this situation, we'd want to consult with medical control for guidance.
Okay.
They can help us weigh the risks and benefits of administering pain relief, considering his existing medications and his vital signs.
Right.
We need to make sure we're giving him the right dosage and that it won't interfere with other treatments.
This whole situation feels incredibly urgent.
It is.
Every decision, every minute seems critical.
You're absolutely right. It's a race against time.
Yeah.
While we're stabilizing him, we need to constantly reassess his vital signs,
Okay.
his blood pressure, pulse, and respirations.
Right.
We're looking for trends.
Okay.
Any changes that might indicate his condition is improving or, more importantly, deteriorating.
And I keep thinking about all those potential internal injuries we talked about.
Yes,
His pelvis feels unstable. He's got that abdominal pain and distension.
right.
It's hard not to jump to conclusions, but what are the most likely injuries we're dealing with here?
Well, based on the mechanism of his injury,
Right.
being ejected from a rolling vehicle,
Right.
a pelvic fracture is very high on the list.
Okay.
Pelvic fractures can be incredibly serious because the pelvis has a rich blood supply.
Yeah.
So there's a risk of major internal bleeding.
And what about that abdominal pain and distension? What's the most likely explanation for that?
That's definitely worrisome because it raises the possibility of injuries to his spleen or liver.
Right.
Both of these organs are also very vascular,
Okay.
and damage to either one could cause life-threatening bleeding. We have to be very cautious and monitor him closely for signs of internal hemorrhage.
So we've got the pelvis, the abdomen. Anything else we should be particularly worried about internally? His age and medical history make me wonder if there could be other complications.
You're thinking like a seasoned EMT.
No, I try.
His age and his history of heart problems make us consider a possible cardiac contusion.
Right.
That's basically bruising of the heart muscle.
Right.
It can occur with blunt force trauma to the chest, which is very likely considering he was ejected from the truck.
Right.
And don't forget, he was complaining of rib pain and had some bruising in that area.
So many things to think about. It's
Rip
like
off.
trying to solve a puzzle with the clock ticking relentlessly in the background. And speaking of the clock, how do we tailor his transport to the hospital, given his potential for internal bleeding and his heart conditions? Do we just go as fast as we can?
Speed is important, of course.
Right.
But it's not just about getting him to the hospital as quickly as possible.
Right.
We need to aim for a smooth and rapid transport, minimizing any bumps or jarring movements that could worsen his injuries
Okay.
or make his heart work harder than it already is.
So I'm the EMT. I've got my patient stabilized as best as I can.
Right.
We're en route to the hospital, sirens blaring. What are the key things I need to be monitoring during transport?
Okay.
What are the red flags that tell me his condition is getting worse?
His level of consciousness is absolutely critical. Any decrease in responsiveness could signal a problem with blood flow to his brain,
Right.
which is a very bad sign.
Yeah.
We also need to keep a very close eye on his vital signs,
Okay.
his blood pressure, pulse rate, and respiratory rate.
Okay.
And I don't just mean checking them once in a while. We're talking continuous monitoring and looking for trends. Is his blood pressure continuing to drop despite the fluids we're giving him? Is his breathing becoming faster or more labored?
Okay.
These are all signs that his condition might be deteriorating.
What about his pain? Should we be asking him about his pain level regularly, or is that something we should just address if he complains about it?
You're right to be concerned about his pain.
Yeah.
Changes in his pain level, either an increase or a decrease, could indicate that his injuries are getting worse
Okay.
or that new complications are developing. And don't forget about monitoring for any signs of external bleeding.
Okay.
We also want to keep an eye on his urine output,
Right.
or the lack thereof, because that can give us a clue about how well his kidneys are functioning.
It sounds like transport isn't just about driving fast. It's also about constant vigilance, careful observation, and being ready to adjust our treatment based on how the patient is doing. Like you're running a marathon while simultaneously playing a game of medical chess.
That's a great analogy. Yeah.
It really highlights the complex and dynamic nature of trauma care, especially in a remote setting like this.
Yeah.
And there's another layer of complexity that we need to discuss, something that often gets overlooked in the heat of the moment.
Okay.
Are you ready to explore that?
Absolutely. Let's dive into that. We're back, and as we navigate this really challenging scenario, there's another layer we need to consider.
Okay.
We focused on stabilizing our patient, addressing those potential injuries, getting him to the hospital. But let's not forget,
Right.
this is a 66-year-old man
Yeah.
with a history of heart problems, diabetes,
Right.
and he's on several medications.
Lots to consider.
How do those factors impact our overall treatment strategy?
Well, his age and pre-existing conditions definitely make this a much more delicate situation.
Right,
For example, his diabetes can affect his body's ability to heal
right.
and increases his risk of developing infections. That means we need to be extra vigilant about monitoring his blood sugar levels
And making sure any wounds are properly cleaned and dressed.
and his heart condition. Does that change how we approach fluid resuscitation? Earlier, we talked about getting fluids into him quickly to combat shock,
Right.
but now I'm wondering if that could put too much stress on his heart.
That's a great question, and it highlights the importance of personalized care.
Yeah,
While we want to aggressively address his low blood pressure,
right.
we need to be careful not to overload his heart with too much fluid.
Okay,
His heart might not be strong enough to handle a sudden increase in volume.
right.
We need to find that sweet spot where we're providing enough fluids to maintain his blood pressure without overtaxing his heart.
So it really is this constant balancing act.
It is. It is.
It seems like communication with the receiving hospital is going to be crucial in this case.
Oh, absolutely.
They need to be ready for him when we arrive.
Clear and concise communication is absolutely essential in trauma care, especially when dealing with a patient as complex as this one. We need to provide the receiving hospital with a detailed report of his condition, the mechanism of his injuries,
Right.
the interventions we've performed, and any changes we've observed during transport.
Okay.
This gives them a heads up and allows them to be fully prepared to take over his care as soon as we arrive. A smooth handoff can make a world of difference.
Thinking back to his medications, the son mentioned that he takes Tenormin,
Yeah,
a beta blocker for his high blood pressure.
right.
How might that affect his response to this trauma?
Here's where things get tricky.
Yeah,
Beta blockers can mask some of the typical signs of shock,
right.
like an elevated heart rate.
Oh, okay.
So we have to rely on other indicators like his blood pressure,
Okay.
mental status,
Okay.
and how well his skin is perfused to assess how serious his condition really is.
It's like trying to read a map with some of the landmarks missing.
Exactly.
We have to rely on our training and experience to kind of fill in the gaps.
You got it.
So we've covered the immediate life-threatening injuries, his medical history, his medications. Is there anything else we need to be mindful of as we care for this patient? Feels like we've thought of everything, but I always wonder if there's something we might be missing.
There's one aspect of trauma care that often gets overlooked,
Oh,
and that's the psychological impact of these events.
right.
This man has just been through a terrifying experience.
Yeah,
His son witnessed the entire accident,
of course.
and he's undoubtedly worried sick.
Right, of course.
How do we address that human side of this situation?
That's a really important point. We tend to focus so much on the physical injuries, the broken bones, the internal bleeding,
Right,
but the emotional trauma can be just as significant.
absolutely.
How do we even begin to offer support in the midst of all this chaos?
Well, you don't need fancy techniques or a psychology degree to provide comfort.
Right.
Sometimes the simplest things make the biggest difference.
Yeah.
Clear communication, reassurance, acknowledging their fear and anxiety. These are powerful tools. Just letting the patient and his son know that we're doing everything we can,
Right.
that we're going to take good care of him, can go a long way in easing their distress.
As we wrap up this deep dive,
Yeah.
what are the key takeaways you want our listener, the EMT in this scenario, to walk away with?
Okay.
What are the most important lessons we've learned today?
I think the biggest takeaway is the importance of a systematic approach to trauma care.
Okay.
From the moment you arrive on scene to the initial assessment,
Right.
to the ongoing monitoring during transport, having a structured approach helps ensure that you don't miss anything critical. It's like having a mental checklist that guides your actions and helps you prioritize care.
And what about the challenges of dealing with a patient with such a complex medical history, like this one?
Yeah,
It feels like every decision has ripple effects.
absolutely. In these situations, you have to be a detective.
Yeah.
Every piece of information matters.
Right.
His age, his medications, his past medical conditions. All of these factors can influence your treatment decisions. You have to think critically and be ready to adapt your plan as you gather more information.
And I can't stress enough the power of clear communication,
Yes,
both with the patient and the receiving hospital.
it really is key.
It's the thread that holds everything together.
Definitely.
This deep dive has been a whirlwind of information,
It has,
a real roller coaster ride through the world of trauma care.
for sure.
We've tackled a challenging scenario, explored the intricacies of assessment and treatment, and hopefully you, our listener, feel a little more prepared to face a similar situation in the real world.
And remember, the learning never stops.
That's right.
Trauma care is a constantly evolving field,
Yeah,
and there's always more to learn.
absolutely.
So stay curious, keep asking questions, and never stop seeking to improve your skills.
Thanks for joining us on this deep dive. Until next time, stay safe out there.
All right, strap in, everyone. Today, we're diving headfirst into a world that most of us only see on TV trauma care. You've given us a mountain of material about this motorcycle accident, so it's like we're right there with the first responders, medical reports, charts, the works.
Absolutely. We've got enough here to make us feel like we're part of the team. We'll see how all the pieces of the puzzle fit together when every second counts.
Okay, so picture this. It's 2:30 p.m. on Highway 69. Our patient has had a motorcycle accident. Apparently, he swerved to avoid a raccoon.
Oh no, those critters can be trouble.
Yeah, and he ended up hitting a rock.
Ouch, that sounds rough. Now, you are the paramedic arriving at the scene. First things first, what's the initial assessment?
Okay, let's see. The report says he's conscious, which is a good sign. Breathing, but it's labored, and there's blood around his mouth, which is concerning. He also has a bunch of abrasions and lacerations.
Yeah, you'd expect that kind of thing with a motorcycle accident, unfortunately.
Definitely. And there's something else. They found medications in his pocket. Digoxin and Slow-K.
Medications. What can those tell us? Well, digoxin is often prescribed for heart conditions, and Slow-K is, as the name suggests, a potassium supplement. So those are things we're going to want to keep in mind as we go through this scenario.
Absolutely. We're already starting to build a picture of this patient, even just from these initial details. But right now, the immediate priority is stabilizing him.
Right. This is where that golden hour concept comes in. Those first 60 minutes after a traumatic injury are absolutely crucial.
Can you tell us why that first hour is so critical?
Well, think about it. In those first minutes, you're dealing with potentially life-threatening issues, uncontrolled bleeding, maybe a collapsed lung, a spinal injury. Prompt medical intervention can dramatically increase the chances of survival. We're talking controlling bleeding, stabilizing fractures, maybe even emergency surgery if needed. Every minute saved can make a huge difference.
Wow, so it's not just about getting to the hospital, it's about doing the right things in those first few moments.
Exactly. Time is literally of the essence.
So let's talk about that initial examination. What does it reveal? What are we seeing here?
All right, let's go through the details. The report describes a large contusion on his chest. There are abrasions over his body, indicating he's taken a tumble. He has an unstable pelvis, which is always a red flag. And this is a significant detail. His left leg is shortened and externally rotated.
Oof, that sounds serious.
It is. That leg position strongly suggests a possible hip dislocation or a fracture in the pelvis. Both of those need immediate attention.
Right. And the report lists his vitals as blood pressure 98/60, a weak pulse, pupils that are slow to react, pale, dry skin as well. So for someone who's not a medical professional, what are the red flags here? What's the big picture?
So these are all classic signs of shock. That low blood pressure, weak pulse, pale skin, they're all pointing to the body struggling to maintain blood flow to the vital organs.
That's already intense, but it gets more complicated because on the way to the hospital, his condition worsens.
Things are escalating.
Yeah, the second cardiac monitor reading figure 1.3 for those following along shows a slower, weaker rhythm. What's happening here?
This deteriorating rhythm is a serious concern. It indicates worsening cardiac output. Essentially, the heart isn't pumping blood effectively.
So it's like the engine is sputtering.
In a way, yes. And this could be progressing towards a state called pulseless electrical activity, or PEA.
PEA. Now, I'm picturing that flatlining heart rate from medical dramas. Is it the same thing?
Not exactly. Think of it this way. Imagine a car with a working engine but a broken transmission. The engine's running, but the car isn't going anywhere.
Okay, I get it. So even though there's electrical activity, it doesn't mean the patient is stable.
Right. It's a life-threatening condition.
So what's next? How do we treat him? What needs to happen right away?
Okay, so the report outlines some initial steps. Immobilization. We want to prevent any further injury. 5E fluids. We've got to combat that shock. And oxygen.
Makes sense. We need to support his breathing. But this is where things get even more interesting because even with treatment, he becomes more lethargic.
Oh, that's not good.
Yeah, so now it's time to play medical detective. If you had to guess, based on everything we've seen so far, what are the most likely diagnoses we're dealing with?
Okay, based on everything we've seen so far, I'd say the top contenders are a fractured pelvis, a dislocated arm, and possibly internal injuries to the spleen or liver.
Okay, so those are our prime suspects, but let's break it down why those specific injuries. How do they connect with what we're seeing?
Sure, the fractured pelvis fits with that leg shortening and rotation we talked about earlier, plus the unstable pelvis during the assessment. The dislocated arm explains the deformity mentioned in the report.
Makes sense.
And then those possible spleen or liver injuries, that's always a big concern with blunt trauma to the abdomen, especially when you see signs of shock.
Why are the spleen and liver such big concerns?
Because they're highly vascular organs, which means they have a rich blood supply. Damage to either one can lead to a lot of internal bleeding, which obviously contributes to shock.
It's fascinating how it all ties together.
Absolutely. Trauma affects the whole body, not just the point of impact.
There's this term in the source material, periorbital ecchymosis. It sounds intense. What exactly are we talking about?
Periorbital ecchymosis, also known as raccoon eyes, is bruising around the eyes. It's often associated with a basilar skull fracture, a break in the bone at the base of the skull.
Raccoon eyes. So we're thinking possible skull fracture.
Well, not necessarily. Raccoon eyes can also be caused by direct trauma to the face, which, given the motorcycle accident, is probably what happened here.
So it's a clue, but not a definitive one.
Exactly. Context is everything in medicine.
All right, this is where I need some help. One of the sources asks about the pathophysiology behind that leg shortening and rotation.
Pathophysiology, huh? You want to get technical?
Well, maybe just a little. Can you break it down for us non-medical folks?
Sure. Basically, pathophysiology is the study of how disease or injury affects the body's functions. In this case, the leg shortening and external rotation are likely due to the forces acting on the hip joint during the accident. With a fractured pelvis, the muscles attached to the hip can pull the leg upwards, causing it to appear shorter. And the external rotation often happens when the head of the femur, the thigh bone, is partially or completely dislocated from the hip socket.
Wow, it's incredible how those anatomical details can reveal so much.
The body speaks volumes if you know how to listen.
Now, remember those medications we talked about earlier, digoxin and Slow-K? Could they be playing a role in how this patient is responding to the trauma?
It's a great question. And it's something medical professionals always have to consider, the potential impact of medications, especially in trauma situations.
Because they could make things worse.
Exactly. So digoxin, as we mentioned, is used to treat certain heart rhythm disorders and heart failure. It can significantly affect the heart's electrical activity and its ability to contract.
So could digoxin make him more vulnerable to those heart rhythm problems we discussed earlier?
It's definitely possible. Trauma puts a strain on the heart anyway, and digoxin might complicate things further. Plus, digoxin can interact with potassium levels in the body. And remember, he was also carrying Slow-K, a potassium supplement. An imbalance in potassium can affect heart rhythm and make him more susceptible to arrhythmias.
Wow, it's amazing how one event can have such a ripple effect throughout the body.
It really is. The body is an incredibly complex and interconnected system.
Speaking of systems, the report mentions his breathing is labored. Is that just from the pain of the chest contusion?
Well, it could be, but we also have to consider the possibility of a pneumothorax.
A pneumothorax, that sounds scary.
It can be. Basically, it's when air leaks into the space between the lungs and the chest wall, causing the lung to collapse.
So we've got a lot going on here. Potential internal bleeding, a possible pneumothorax, heart rhythm abnormalities, and those medications adding another layer of complexity. where do we even begin to untangle all of this?
That's the challenge in the art of trauma care. You have to take all these pieces of information, symptoms, vital signs, medical history, and fit them together to form a complete picture. It's like solving a puzzle, but the stakes are incredibly high.
Well, this deep dive has already opened my eyes to how complex and intense trauma care can be. It's so much more than just treating injuries. It's about understanding how all the body systems work together and how they respond when things go wrong.
Exactly. And there's still more to uncover as we continue to analyze his condition and explore those potential complications.
I'm ready to keep digging. Stay tuned for part 2 of our deep dive, where we'll go even deeper into this fascinating case.
Welcome back. It's really fascinating how each new piece of information we get adds another layer to this case. Kind of like a medical detective novel, wouldn't you say?
I'm still trying to wrap my head around everything. Shock, PEA, potential internal bleeding, those medications he was taking, all those systems involved. It's like a medical jigsaw puzzle where the pieces keep changing shape.
That's a great way to put it. It really highlights the need for medical professionals to consider the whole patient, not just the immediate injury, but also how it might interact with any pre-existing conditions or medications they might have. It can make all the difference. In fact, one of the sources asks a really interesting question about our patient. What about his age? How could that be a factor?
That's a good point. We haven't really talked about his age yet. Does that play a role in how someone responds to trauma?
Absolutely. As we age, our bodies don't bounce back as easily. Our physiological reserves, that buffer we have to withstand stress, it tends to decline.
So an older person might be more likely to go into shock and have a harder time recovering.
It's a definite possibility. Their cardiovascular system might not be as efficient at compensating for blood loss, for example. Blood vessels might not constrict as well. It all adds up.
Okay, so age is another piece of the puzzle. One of the sources also points out his low blood pressure, but mentions that his heart rate is increased. Isn't that the body trying to compensate?
It is. But the question is, how effective is that compensation in someone who already has a heart condition and is taking medication like digoxin? His baseline cardiovascular function might already be compromised.
So it's like his body is trying to do the right thing, but it's working with a handicap because of his heart condition and the medication.
Exactly. It really underscores the importance of knowing a patient's full medical history when you're treating trauma. You can't just focus on the injury itself.
Speaking of trying to put all the pieces together, the report mentions a distended abdomen. What does that tell us?
A distended abdomen, especially in a trauma case like this. That could be a sign of internal bleeding.
So which organs are we most concerned about when we see that?
In this scenario, with the mechanism of injury and everything else we've seen, I'd say the spleen and liver are the top of the list. They're both highly vascular, located in the upper abdomen, and prone to injury and blunt trauma. Damage to either one can cause a lot of bleeding into the abdominal cavity, which would lead to that distension.
Okay, spleen and liver, those are our main suspects. But could other organs be involved?
It's possible, though less likely in this case. We can't completely rule out injuries to the kidneys, intestines, or even the pancreas. A thorough assessment and some imaging studies, like a CT scan, would be needed to get the full picture.
This deep dive is really making me appreciate how much goes into diagnosing and treating trauma. It's like a medical detective story, isn't it? There's a question in one of the sources about treatment for attention pneumothorax and whether it might actually be contraindicated in this case.
Ah, yes, the tension pneumothorax. That's a very important point.
Can you remind us what attention pneumothorax is and why we wouldn't want to treat it? It sounds pretty serious.
Of course. Attention pneumothorax is a life-threatening condition where air gets trapped in the pleural space. That's the area between the lung and the chest wall. And it keeps building up. This puts pressure on the heart and lungs, causing a rapid drop in blood pressure. It can lead to circulatory collapse if it's not treated.
So basically the lung collapses and then keeps getting squeezed.
Essentially, yes. It's a very serious situation. Normally, you treat it immediately with needle decompression. That's where a needle is inserted into the chest to release the trapped air.
Okay, so it's a serious situation, but why wouldn't we treat it in this case?
Here's the dilemma. The patient's already in a state of shock, remember. Low blood pressure, and we're worried about internal bleeding. The needle decompression procedure, while necessary to relieve the pressure on the heart and lungs, can actually further lower blood pressure.
So it's a tough call. You need to relieve the pressure on the lungs and heart, but you can't risk making the circulatory system worse.
Right. It's a judgment call based on the patient's overall condition and what resources are available.
Sounds incredibly complex, like every decision has a potential downside. There's also a question about the patient's Glasgow Coma Scale score, or GCS, and how it changes throughout the scenario.
The GCS, yes, that's a very important tool.
Can you remind us what it is?
Of course. The GCS, or Glasgow Coma Scale, is a numerical scale used to assess a person's level of consciousness. It looks at things like eye-opening, verbal response, and motor response to help determine the severity of a brain injury.
So what happened with his GCS score in this case?
Initially, he was conscious and responsive, which would give him a relatively high GCS score. But as his condition worsened, he became more lethargic and eventually slipped into unconsciousness. This indicates a worsening neurological status, which could be due to shock, a head injury, or both.
It's amazing how quickly things can change in trauma care. It really keeps you on your toes, doesn't it?
Absolutely. It underscores the importance of constant monitoring and early detection of any changes.
Yeah.
Every detail matters.
This deep dive has been a real eye-opener. I had no idea how much goes into trauma care, all the decisions that need to be made, the constant balancing act. It's fascinating and incredibly complex.
And we're not done yet. There are still a few loose ends to tie up and some challenging questions to consider.
I can't wait to see where this deep dive takes us next. Stay tuned for the final part of our exploration of this complex trauma scenario. Welcome back, everyone, for the final part of our deep dive into this trauma scenario. It's been quite a journey, hasn't it? We've covered so much ground shock, potential internal bleeding, those split-second decisions that can make all the difference.
It really highlights how trauma care is like a high-stakes game of chess, wouldn't you say?
Mm-hmm.
Every move you make has consequences, and you have to be thinking several steps ahead.
Exactly. And speaking of thinking ahead, one of the sources brings up a really interesting point about why treatment for attention pneumothorax might actually be risky in this specific case.
Ah, yes. The tension pneumothorax dilemma is a fascinating point.
Can you remind us what attention pneumothorax is again, and why we would even consider not treating it? Because it sounds pretty serious.
You're right to be concerned. It is serious. It's a life-threatening condition where air gets trapped in the pleural space. That's the area between the lung and the chest wall. And this buildup of air, it puts pressure on the heart and the lungs, causing a rapid drop in blood pressure. And it can lead to circulatory collapse if it's not treated.
So basically the lung collapses and then keeps getting squeezed.
Essentially, yeah.
Yeah.
It's a very serious situation. Normally, you treat it right away with needle decompression. That's a procedure where a needle is inserted into the chest to release that trapped air.
Okay, so that's attention pneumothorax. Bad news. But why would we hesitate to treat it in this particular case? What's the catch?
Well, here's the dilemma. The patient is already in shock, remember? Low blood pressure, possible internal bleeding. The needle decompression procedure, while it's necessary to relieve that pressure on the heart and lungs, it can actually lower blood pressure even further.
So it's like a delicate balancing act. You have to weigh the risks and benefits very carefully.
Precisely. It's a judgment call that the medical team would have to make based on the patient's specific presentation and what resources they have available.
It really makes you realize that trauma care is so much more than just treating individual injuries.
In 600 meters, turn left onto Ontario 6.
Absolutely. You have to see the whole picture and anticipate how each intervention might affect the patient's overall condition.
There's also a question in the source material about the changes in the patient's Glasgow Coma Scale score, or GCS, throughout the scenario.
The GCS, yes, that's an important one.
Can you remind us what that is?
Sure. The GCS, or a Glasgow Coma Scale, is a numerical
At the
scale
light,
that's used
turn
to
left
assess
onto Ontario 6. Signs for Manitoulin Island, Espanola.
verbal response and motor response. It helps us to determine the severity.
Continue for 52 kilometers.
So what happened to our patient's GCS score in this case?
Initially, he was conscious and able to respond, which would give him a relatively high GCS score. But as his condition worsened, he became more lethargic and eventually slipped into unconsciousness. This indicates a worsening neurological status, which could be due to shock, a head injury, or a combination of both.
It's scary how quickly things can change in these situations. You really have to stay on top of things.
Absolutely. That's why constant monitoring is so crucial. You have to be able to detect those subtle changes and adjust the treatment plan accordingly.
It's amazing how much we've been able to learn about trauma care just by analyzing these reports and charts. It's been like a masterclass in medical detective work.
It has been a fascinating exploration, hasn't it? And it really shows how every detail, every symptom, every vital sign tells a story.
It's like piecing together a puzzle, but with incredibly high stakes.
That's a great analogy. It really highlights the intellectual challenge and the immense responsibility that comes with working in trauma care.
Well, this deep dive has certainly given me a whole new perspective on what it takes to be a trauma care professional. The knowledge, the quick thinking, the constant decision making. It's really impressive.
It is a demanding field, no doubt. But it's also incredibly rewarding to be able to make a difference in those critical moments, when someone's life hangs in the balance.
I think we've covered a lot of ground today. We've explored the complexities of trauma care, the interconnectedness of all the body systems, and the importance of those split-second decisions.
It's been a really great discussion, and hopefully our listeners have come away with a deeper understanding of this fascinating and vital field.
Well, on that note, I think it's time to wrap up this deep dive. Thank you so much for joining me today and sharing your expertise. It's been an incredible learning experience.
The pleasure was all mine. And to all our listeners out there, remember, knowledge is power. Keep asking questions, keep learning, and never stop exploring the world around you.
Until next time, stay curious and stay well informed.
Hey everyone, and welcome to another deep dive just for you.
Yeah, always fun to dig into these.
Right. So tonight, we're stepping into the shoes of first responders.
Oh, cool.
For a case that's definitely not your run-of-the-mill call.
All right, lay it on me.
So picture this. It's a quiet Sunday night in June.
Okay, peaceful.
You're an EMT, and you get called out to a motor vehicle accident.
Seems pretty standard so far.
Yeah, but here's the twist. This accident involves a moose.
Oh, wow. Okay, that's not what I was expecting.
I know, right? To help us figure this out, we've got some sources.
Okay, cool.
We've got excerpts from a paramedic training manual
That's always helpful.
and some patient assessment notes.
So we're like medical detectives piecing together the story.
Exactly. So let's start with the scene.
All right, paint me a picture.
Okay, so we're on a rural road.
Okay.
There's a lone car with some serious damage to the front end.
Ooh, sounds like a pretty bad impact.
Oh yeah, it definitely wasn't a fender bender.
I'm guessing the moose didn't walk away from this one.
Definitely not. So our sources say the moose, which was estimated to be about 450 kilograms.
Whoa, that's a big moose.
Yeah, almost 1,000 pounds.
Like a small horse.
Right. And this moose was actually knocked over the car.
Wow, I mean, that gives you an idea of the force involved here.
Right.
Now, what about the driver?
So inside the car is our patient.
Okay.
She's a woman 36 weeks pregnant.
Oh, wow. 36 weeks.
Yeah, talk about high stakes.
Things just got a lot more complicated.
I know, right? But thankfully, she was able to drive off the road after hitting the moose.
Okay, good. At least she's out of immediate danger.
Yeah, now let's take a look at the initial patient assessment.
All right, this is where it gets interesting.
Yeah, these notes are like a snapshot of what those first responders are dealing with when they arrive.
Gives you a real appreciation for their quick thinking,
Absolutely. So our patient is conscious,
Okay, that's good.
but a little confused.
Uh-huh.
And she's complaining of leg pain, which isn't surprising.
Right. Given the impact.
Her vitals are a bit concerning, though.
Okay, what are we looking at?
Her blood pressure is 8868.
Ooh, that's a little low.
Her pulse is 150, respirations are 26, and her oxygen saturation is 96%.
Okay, so that low blood pressure and the rapid heart rate, those are already suggesting early signs of shock?
Yeah, there are definitely some red flags there.
For sure.
So continuing with the assessment, she has some mild neck pain.
Which you always got to watch out for after any collision.
Absolutely.
And what else?
And she's got an abrasion on her abdomen, probably from the seatbelt or the steering wheel.
Makes sense.
But here's the big one.
Okay, hit me.
Bilateral femur fractures.
So both thigh bones are broken.
Yep, and a deformed right ankle.
Whoa, that's a lot of trauma.
Yeah, and the notes also mention delayed capillary refill.
Which further supports that possibility of shock.
Right, so definitely a lot to process for the paramedics at this point.
Absolutely, we gotta act fast.
Yeah, what would be the next steps?
Well, based on this initial assessment, they gotta stabilize her spine, make sure she's getting enough oxygen,
Right,
and get her out of that car safely and quickly.
which is exactly what they do.
Yeah.
They gave her oxygen right away, immobilized her spine with a C-collar, and went for a rapid extrication.
All standard procedure in a situation like this?
Right, oxygen's crucial, especially with the baby.
Yep, for both of them.
And immobilizing the spine protects against further injury.
And the rapid extrication, that's all about getting her out of that potentially dangerous situation fast.
Exactly. They also established 5E access,
Oh yeah,
so
critical.
they could administer fluids and medications.
Yep, that IV access, lets them address that potential shock quickly.
By replenishing fluids and maybe giving her meds to stabilize her blood pressure.
Exactly.
Now, the source material actually poses a question for us here.
Oh, okay, I like a good challenge.
They ask, how much blood do you think she might have lost at this point?
That's a tough one to answer.
Right.
You know, highlights the challenges these first responders face, having to make decisions with limited information.
Yeah, they're relying on their experience and judgment.
Exactly.
And then they hit us with another question.
All right, what is it?
Why might the signs of shock be delayed in a pregnant patient?
Oh, that's a good one.
Yeah, what do you make of that?
Well, you got to remember that pregnant women have a higher blood volume than non-pregnant women.
Oh, right, of course.
So their bodies can compensate for blood loss for a longer time before showing those classic signs of shock.
So it's like a hidden danger.
Yeah, exactly. So even though those initial vitals are concerning,
Right.
the full extent of her blood loss might not be obvious right away.
So those paramedics really have to be on high alert.
Yeah, especially with a pregnant patient. They got to keep reassessing the situation.
So far, it seems pretty straightforward.
You mean a traumatic accident, potential shock, serious injuries?
Yeah, but trust me, things are about to take a bit of an unexpected turn.
Oh, really? Tell me more.
So, about 25 minutes after arriving at the scene,
Okay.
the notes mention a wall being lifted.
A wall.
Yeah, and secured before they can finally remove the patient from the car.
A wall. That's strange.
Right.
Why was there a delay?
And that's where it gets really interesting.
Okay, hooked.
The source material starts talking about crush injuries
Crush injuries, okay.
and this thing called compartment syndrome.
Compartment syndrome.
Honestly, it sounds kind of terrifying.
It can be a serious condition,
Yeah,
but maybe we should break it down for our listeners.
yeah, good idea.
So imagine a garden hose, right?
Okay, with water flowing through it.
Exactly. Now imagine someone steps on that hose, restricting that water flow.
Okay, I get it.
That's kind of what happens in compartment syndrome.
So what's being crushed in this analogy?
So inside your muscles, there are these tight compartments,
Uh-huh.
and when pressure builds up in one of those compartments, it can restrict blood flow, leading to tissue damage.
So like the muscles being squeezed from the inside.
Yeah, good way to put it.
But the moose didn't exactly sit on her legs, did it?
No, but remember those bilateral femur fractures?
Oh, right, of course.
Severe fractures like that, they can disrupt the muscles and blood vessels within those compartments.
Leading to that dangerous pressure increase.
Exactly.
So even though it wasn't a direct crush injury,
Right.
those fractures themselves could create that compartment syndrome scenario.
Precisely.
And maybe that 25-minute delay
Yeah,
was because they were dealing with this really complicated extrication
trying to safely remove whatever was causing that compression.
without making her injuries worse.
It's a tricky situation.
Right. They're always having to think one step ahead, anticipate those potential problems.
That's what makes this case so interesting. It's not just about treating the obvious injuries.
Right.
It's about understanding the underlying physiology.
And recognizing those patterns.
Hey.
Okay, so we've covered a lot in this first part. The initial impact, the signs of shock, and this potential compartment syndrome.
Yeah, we've definitely got our work cut out for us.
But there's still a lot to unpack.
Definitely. I'm ready for more. What else do we need to dive into?
Well, we got to understand the signs and symptoms of compartment syndrome
Right, so we can see how those paramedics would even recognize it.
in a patient who's already in a lot of pain.
And dealing with multiple injuries.
Exactly.
Sounds like a challenge.
It is, but we'll tackle it head on.
All right, let's do it. All right, so let's talk about those signs and symptoms of compartment syndrome.
Yeah, because it can be tricky, right?
It can, especially when you've got a trauma patient.
Who's already in pain from other injuries.
Exactly. So those paramedics, they really have to rely on their training.
To look for those subtle clues.
The things that suggest something more serious might be going on.
Like, what kind of clues should they be looking for?
Well, one of the key signs is pain.
Okay, pain makes sense.
But it's pain that seems way worse than what you'd expect.
Oh, so like out of proportion to the injury.
Exactly. So in this case, she might have leg pain that's just way more intense.
Than what you'd expect from just those fractures.
Exactly.
Okay, so that's one red flag.
Yeah.
Excruciating pain. What else?
Swelling.
Okay, swelling. That seems pretty obvious.
It is, the affected limb might look swollen and tense.
That's got it. Extreme pain, swelling, anything else?
They'd also check for changes in sensation,
Oh. Yeah.
like numbness, tingling.
Oh, like pins and needles.
Yeah, exactly.
And is that because the pressure is cutting off blood flow to the nerves?
That's right, affects the nerves.
Okay, got it.
And finally, they'd be checking for weakness.
weakness, how would they assess that?
Well, the patient might have trouble moving their toes or foot,
Okay.
or they might have a really weak pulse in the injured limb.
So we're talking pain, swelling, numbness, and weakness.
Right.
Those seem like pretty subtle signs, especially considering everything else she's going through.
They are subtle, and that's why it takes a really skilled eye.
And a deep understanding of these complications.
To catch them early on, that's why those initial assessments are so crucial.
It's like laying the foundation.
Yeah.
Checking those vital signs, stabilizing the spine, making sure she's getting oxygen.
All those steps are so important.
Yeah, and it's not just a one-time thing.
Right. They have to keep reassessing, looking for changes.
That might point to a new problem.
Exactly.
Now, remember those thought-provoking questions from the source material?
You mean the ones about blood loss and the delayed signs of shock?
Yeah, exactly. They also ask what the paramedics might anticipate based on the mechanism of injury.
Okay, so they're asking us to think like a paramedic, right?
Right. Like, what would stand out to you?
Considering the moose, the speed, the damage to the car.
Exactly.
Well, the first thing that comes to mind is internal injuries
Oh, yeah.
beyond the obvious fractures.
Right. And she's 36 weeks pregnant,
Don't forget about that.
which adds a whole other layer of complexity.
Absolutely. You got to think about complications for both the mother and the baby.
Like, what kind of complications?
Oh, things like placental abruption.
Placental abruption.
Yeah, where the placenta detaches from the uterine wall.
Wow.
Urine rupture, fetal distress. These are all serious possibilities.
It's like a chain reaction of potential problems.
It is a lot to think about.
And then they ask another question.
Okay, lay it on
Given her presentation and injuries,
me. Yeah.
how much blood do you think she might have lost?
Ooh, that's tough. There's no way to know for sure.
It's not like they can just measure it out on scene.
Nope. It comes down to experience, clinical judgment.
And understanding those typical blood loss patterns.
Right, with different injuries.
So considering her vitals, the mechanism of injury,
And those bilateral femur fractures.
which we know can bleed a lot.
Yeah, it wouldn't be surprising if she'd lost at least 1 to 2 liters of blood.
That's a lot. Then we talked about how pregnancy can mask those early signs of shock.
Exactly. So even if her vitals aren't screaming hemorrhage,
Right.
they got to be really tuned in to those subtle cues.
And consider that hidden blood loss
Absolutely. It all comes back to those ongoing assessments.
and that high index of suspicion.
Always got to be thinking, reevaluating.
Now, the last question focuses on the pregnancy.
Okay, what does it say?
Although this patient is presenting with symptoms of shock, why might the signs be delayed?
Okay, we touched on the higher blood volume,
Right.
but there's more to it, isn't there?
Right. It's not just about having more blood to lose.
No.
What other changes during pregnancy could be at play here?
Well, their heart rate's naturally higher during pregnancy.
Oh, right, of course.
So that tachycardia,
That rapid heart rate,
yeah, that might not be as alarming.
as it would be in a non-pregnant patient.
Exactly. Their baseline is different.
So it makes interpreting those vital signs trickier.
It does.
And their blood pressure is usually lower too, right?
Yeah, so it's harder to spot hypotension.
That low blood pressure.
In those early stages of shock.
It's like pregnancy is almost creating a camouflage effect,
Yeah, you could say that.
making those warning signs harder to see.
Right, and on top of that,
Oh, there's more.
yeah, pregnancy hormones, they can actually affect how the body responds to blood loss.
Oh, wow. How so?
They cause blood vessels to relax, which further masks the signs of hypovolemia.
Hypovolemia, that's the low blood volume, right?
That's right.
So paramedics really have their work cut out for them
They do. It's a whole other level of complexity.
when you're dealing with a pregnant trauma patient,
Yeah, and it shows why specialized training is so important.
right? Because you can't just rely on those standard signs and
You
symptoms.
gotta factor in all those physiological differences.
Absolutely. This deep dive's really opening my eyes
Yeah, it's fascinating.
to just how much goes into those decisions paramedics make at the scene.
They have to consider so many factors.
It's like a high stakes puzzle
It is.
where they have to piece together all this information
And make those life-saving decisions.
based on what they find.
And often with very limited time.
Right,
It's
exactly.
a real testament to their skill and training.
Absolutely. Okay, so we've talked about the signs of compartment syndrome.
Uh-huh.
We revisited those key questions and explored the challenges of treating a pregnant trauma patient.
We've covered a lot of ground.
What else does the source material want us to think about?
Well, it talks about the management of compartment syndrome,
Okay,
emphasizing how important early recognition and treatment are.
right, makes sense.
But before we get into that,
Yeah.
Let's go back to that mysterious wall
Oh yeah, that's been bugging me.
and that 25-minute delay in getting her out of the car,
Because we talked about how it might have been a complicated extrication,
right?
but why delay getting her out when there's a potential for shock and other complications?
That's a great question, and it really highlights the challenges these first responders face.
In what way?
Well, they're not just treating the patient,
Right.
they're also responsible for scene safety.
Oh, of course, for themselves and everyone else there.
Exactly. So during those 25 minutes, they're assessing the situation.
Trying to figure out the safest way to get her out
Right. How to remove that wall or whatever's pinning her legs.
without causing more injury.
Exactly. They got to think about the stability of the vehicle.
Right, could it shift or collapse during extrication?
Exactly. And they got to consider the risk of making her existing injuries worse.
It's like a delicate balancing act,
It is. They want to get her out fast.
but safely.
Right. And don't forget about that potential crush injury.
Oh, right, if they move that wall the wrong way.
It could make things a lot worse.
It sounds incredibly stressful.
It is. They're making these split-second decisions
With limited information.
and knowing that every choice could have big consequences.
It really highlights the importance of training and experience.
Absolutely. And clear communication between everyone on scene.
It's teamwork.
It is. This deep dive's really showing me
Yeah, me too.
how complex their work really is.
It's so much more than just bandages and ambulance.
It's a blend of science, skill, and compassion,
And it requires constant learning.
and mapping to new situations.
All right, so we talked about the extrication delay,
Uh-huh.
the potential for crush injuries, the challenges of managing a pregnant trauma patient.
What's next on our agenda?
Well, now that we understand compartment syndrome.
Right. What it is, why it's a concern in this case.
Exactly.
We need to explore how it's diagnosed and treated.
Because recognizing those subtle signs early on,
That can make all the difference.
absolutely. Lead the way. I'm all ears. Okay, so how do they actually diagnose compartment syndrome?
It's not always easy.
Right, because it's not just about looking for those signs and symptoms.
Exactly, especially when you've got a trauma patient.
Who might be in pain from a bunch of different injuries.
Right, it can be tough to tell what's causing what.
So what else can they do to figure it out?
Well, they can measure the pressure.
The pressure.
Yeah, inside those muscle compartments.
Oh wow, they can actually measure that.
Yeah, they use a special device,
What's it called?
a pressure monitor.
Okay.
It's basically a small needle
Okay.
that they insert into the muscle compartment.
And that tells them the pressure inside.
Exactly.
So if the pressure's high,
Then that's a pretty clear sign of compartment syndrome.
and I'm guessing that helps them decide what to do next.
Absolutely, it guides their treatment decisions.
So what kind of treatment are we talking about here?
The most effective treatment is surgery.
Surgery. Oh wow.
Yeah, it's called a fasciotomy.
A fasciotomy.
Yeah, basically they make an incision
An incision. Where
in the fascia.
the fascia, remind me what that is again?
It's that tough membrane that surrounds the muscle compartment.
Right, okay.
And that relieves the pressure.
So it's like opening up that garden hose we talked about.
Exactly.
Letting the blood flow freely again.
Precisely. And that can prevent more tissue damage.
And potentially save the limb.
That's the goal.
Wow, this case is really showing just how important quick thinking is in these situations.
It's crucial. Got to be able to make decisions under pressure.
And how important that initial assessment is.
Absolutely. Got to recognize those subtle signs, know when to call for help.
It can make all the difference.
It really can.
Now, the source material doesn't actually say
Mm-hmm.
if our patient ended up developing compartment syndrome,
Right.
but they do leave us with something to think about.
Oh, I like a good challenge. What is it?
They revisit those questions about blood loss and shock in pregnant patients.
Right, right.
But then they add a new one.
Okay, I'm listening.
They ask, what other injuries might the paramedics anticipate
Okay.
based on the fact that a wall had to be removed before they could get her out of the car?
Interesting.
So they're asking us to think beyond those obvious injuries, the fractures, and the potential shock,
And consider what else might be going on?
based on that detail about the wall.
Right. Got to put our detective hats on.
Exactly. What other injuries could that wall have caused?
Well, it's possible the wall was putting direct pressure on her pelvis.
Oh, so on top of everything else, we could be dealing with pelvic fractures.
Exactly. And those can be really serious.
Yeah, I imagine so.
Often a lot of blood loss, and they can make the pregnancy even more complicated.
So even after they deal with the femur fractures, the potential shock,
They still got to be on the lookout for other injuries.
those hidden dangers that might not be obvious right away,
Exactly. That's why those ongoing assessments are so important.
they can't just assume that what they see initially is the whole story.
Nope. Gotta keep looking for clues.
This whole case has really been a deep dive
It has.
into the world of trauma care
The complexities, the challenges.
and how much those paramedics have to juggle.
They have to be quick thinkers
Skilled clinicians,
and compassionate caregivers.
all while working under immense pressure.
It's impressive.
It really is, and they're doing it all with limited information.
Often in really chaotic environments.
It's inspiring, honestly.
Absolutely testament to their dedication and expertise.
Well, I think we've covered it all.
Yeah, I think so.
The initial assessment, the potential for shock, compartment syndrome, managing a pregnant trauma patient.
And all those hidden injuries.
It's been quite a journey,
It has a real deep dive.
and I hope you, our listener, have learned something new
Yeah, I gained a new appreciation for those first responders.
and the amazing work they do.
They're true heroes.
So until our next deep dive,
Stay curious.
and keep those brains engaged.
There's always more to learn.
We'll see you next time.
Welcome to the deep dive. Today we're diving into the world of toxicology and substance abuse,
Okay.
but not like in a lecture hall kind of way.
Right.
We're going to be using real case studies from a paramedic textbook to kind of understand how those folks think on their feet when every second counts.
Yeah, that's right. We're essentially going to be training you
Right.
to approach these situations like a first responder would.
Exactly. Now you might be thinking, why would I need that? But have you ever been in a situation where someone was having like a bad reaction to something?
Oh, yeah.
Maybe too much caffeine, or even just mixing medications?
Sure.
Understanding the basics of toxicology can help you stay calm and know what to do,
Absolutely.
which can literally be life-saving.
And what's interesting is that toxicological emergencies aren't always about illegal drugs or anything like that.
Right.
It could be something as simple as accidentally taking too much of a common over-the-counter medication.
Okay, let's dive into our first case. Imagine this. You're at the gym and you see someone collapse near the weights.
Jeez.
That's Jean-Guy in our first scenario. He's a middle-aged guy, conscious but confused, and his skin is flushed.
Okay.
We learn he has a history of fainting spells while lifting weights.
Yeah,
Already a few red flags, right?
definitely. And then you check his vitals.
Oh boy.
Blood pressure is sky-high, heart's racing like crazy.
Oh wow.
Next to them are a couple of empty energy drink cans,
Oh.
which immediately raises a question for me.
Right, like how much caffeine did this guy have?
Exactly.
But there's another twist. Jean-Guy admits to taking some energy pills before his workout.
Interesting.
Now I know those supplements are popular,
Yeah.
but are they really safe?
That's where things get tricky. You see, some of these supplements contain ingredients like ephedra,
Okay.
which can have serious side effects on their own. But when you combine them with the caffeine from energy drinks,
You're in trouble.
you're essentially putting your cardiovascular system into overdrive. That explains Jean-Guy's high blood pressure, rapid heart rate.
So it's not just about the individual substances, but also how they interact.
Exactly.
It's kind of like a dangerous cocktail.
Exactly. And what's really concerning is how common this combination
My
is.
vocals are getting good.
People
Start
often
singing.
don't realize the potential risks they're taking by mixing these substances.
It's a good reminder to always read labels and be aware of what you're putting into your body.
Absolutely.
And to think we're only on our
Towards
first
and
case.
last
Yeah.
stop.
Okay, let's
Three
shift
cones.
gears a bit and talk about
One
Tammy.
cow.
Right.
This case highlights a different kind of toxicological emergency, one that's driven by emotional distress.
Okay.
We find Tammy on a couch, distraught and confused. She's been crying, feeling weak, and admits to taking a bunch of pills after a bad breakup.
Wow.
The empty pill bottle nearby is labeled orthotricycline low,
Okay.
which are birth control pills.
TM.
Now, while a large amount of birth control pills
Hello.
isn't usually
Hello,
fatal,
sir.
Right.
it can still lead to serious complications. We might see nausea, vomiting, and even blood clots.
Yeah, that's right.
It's heartbreaking to think that someone would feel so desperate to take that kind of risk with their health.
Yeah.
It makes you realize that emotional well-being plays a huge role in these situations.
It's a crucial reminder that mental health and substance use are often intertwined.
Right.
Sometimes the substance is a way of coping with emotional pain,
Yeah.
but it can lead to even bigger problems down the road.
It's a vicious cycle. And speaking of cycles, our next case brings us to Jeremy,
Okay.
who's experiencing a completely different kind of toxicological
Oh, shoot, is that
crisis.
Genesis?
This one's less about emotional distress and more about well pain.
Right.
Jeremy is found clutching his stomach pale and sweating.
Yeah.
He's complaining of intense stomach pain, and alarmingly, he's vomiting blood.
Oh, geez.
Yikes!
That doesn't sound good.
What caused this?
He reveals he took a large amount of aspirin a common over-the-counter pain reliever.
Wait, aspirin?
Mhm.
But that's in everyone's medicine cabinet. How can that be dangerous?
It's all about dosage. Aspirin, when taken in excess, can cause internal bleeding, which explains the blood in Jeremy's vomit. We also see his pulse is rapid and irregular, and his blood pressure is dropping.
Uh-oh.
Not good signs.
So what we're seeing here is that even seemingly harmless everyday substances can turn dangerous if misused or taken in excess.
Exactly. It's all about understanding the potential risks and respecting the power of these substances. Now, before we move on, are you noticing any similarities between these cases so far?
Well, they all involve substances that seem pretty common. Energy drinks, birth control pills, aspirin.
Right.
You wouldn't necessarily think of those as dangerous.
And that's a great observation.
Yeah.
And that's exactly why toxicological emergencies can be so tricky.
Okay.
It's not always about illegal drugs or obvious poisons.
Right. It's a good reminder that anything can be harmful if not used responsibly.
Absolutely.
But how does this all connect to how our bodies actually react to these substances?
That's where things get really fascinating. Let's take a closer look at some of the major systems in the body and how they're affected. Think of your body like a complex machine with different systems all working together.
Okay.
When a substance enters the picture, it can disrupt those systems in various ways.
Okay. So let's break it down. Where should we start?
Let's start with the central nervous system, the command center of your body.
Okay.
This includes your brain and spinal cord.
The brain, the control center for pretty much everything we do.
Exactly. Substances can interfere with the way the brain sends and receives signals, affecting everything from mood and behavior to basic bodily functions and breathing.
So like in Tammy's case, the emotional distress she was feeling could have been amplified by the overdose.
That's a great connection. And remember Jongai's confusion after mixing energy drinks and supplements.
Right.
That's another example of the central nervous system being affected.
It's amazing how one system can have such a widespread impact. What about the cardiovascular system? That's the heart and blood vessels, right?
Right. And this system is often a target for substances, especially stimulants.
Okay.
Think back to Jongai's racing heart and high blood pressure. Those are classic signs of a stimulated cardiovascular system.
Makes sense. His heart was working overtime trying to keep up with all that extra energy.
Exactly. And on the flip side, some substances can depress the cardiovascular system, leading to a dangerously slow heart rate and low blood pressure.
Okay, so we've got the brain and the heart.
Right.
What's the third system we should be thinking about?
The respiratory system responsible for breathing.
Right.
Substances can affect this system in a number of ways,
Okay.
either by speeding up breathing or slowing it down.
Okay.
Remember Tammy's shallow breathing?
Yes.
That could have been a result of the overdose affecting her respiratory system.
And Jeremy's rapid breathing too.
Exactly.
So basically when someone is experiencing a toxicological emergency, it's like a domino effect.
Yeah,
One system gets hit and it can trigger problems throughout the body.
you've got it. And that's why understanding these systems is so important for paramedics in the field.
Right.
They need to be able to quickly assess the situation and figure out which systems are being affected.
It sounds like they're playing a high-stakes game of medical detective. How do they even begin to approach these emergencies? I mean, there are so many potential substances out there.
It's all about observation information gathering and connecting the dots. Paramedics are trained to be incredibly observant, taking in everything from the patient's appearance and behavior to the surrounding environment.
So they're not just looking at the patient, but also at the bigger picture?
Yeah.
Kind of like Sherlock Holmes searching for clues?
Exactly.
Huh.
They'll look for things like medication bottles, drug paraphernalia, or even chemical spills.
Yeah.
They'll also talk to bystanders, family members, or anyone who might be able to provide information about what happened.
And then there are the vital signs, which we've already talked about.
Mhm.
Those seem to be crucial in these situations.
Absolutely. Vital signs like heart rate, blood pressure, respiratory rate, and even pupil size can tell us a lot about what's going on inside the body.
It's amazing how much information paramedics can glean from those simple measurements.
It's all about recognizing patterns and deviations from the norm. A rapid heart rate could indicate stimulant use,
Okay.
while constricted pupils might suggest opioid involvement.
Interesting.
Paramedics use this information along with their knowledge of toxicology to guide their treatment decisions.
Okay, so let's talk about treatment. What can paramedics actually do in the field for these emergencies?
That's a great question. The treatment really depends on the specific substance involved and the severity of the situation. Sometimes the most important thing is to provide supportive care,
Supportive care. What does that mean?
It means ensuring the patient has a clear airway, providing supplemental oxygen if needed, and closely monitoring their vital signs.
So basically keeping them stable until they can get to the hospital.
Exactly. But in more serious cases, paramedics might need to administer specific antidotes.
Antidotes. Like an antidote for a snake bite.
Yes, exactly. For example, naloxone is a powerful antidote for opioid overdoses.
Okay.
It can rapidly reverse the effects of opioids like heroin or fentanyl.
Naloxone, that's one we hear about a lot in the news,
Yeah.
especially with the opioid crisis.
That's right. It's becoming increasingly important as a harm reduction tool and can truly be a lifesaver in those situations. But it's crucial to remember that not every overdose has a specific antidote.
So what happens in those cases?
Paramedics focus on managing the symptoms and supporting the body's natural detoxification processes. They might administer fluids intravenously to help flush the substance from the system, or medications to control seizures or vomiting.
Wow, it sounds like paramedics have to be incredibly adaptable and resourceful in these situations.
They absolutely do. They're essentially mobile intensive care units equipped to handle a wide range of medical emergencies.
It makes you appreciate the critical role they play in our healthcare system. They're often the first on the scene, and their quick thinking and expertise can make all the difference.
They are truly unsung heroes. Their work is often challenging and high pressure, but they're dedicated to saving lives.
Okay, I have to ask, what's one of the most memorable or unusual toxicological emergencies you've encountered in your career?
Cool.
There must be some wild stories.
Well, the one case that sticks with me involved a young man who was found unconscious in a park.
Okay,
His symptoms were unusual. Extremely high body temperature, dilated pupils, and he was acting very agitated.
sounds like a scene straight out of a movie.
It did feel a bit surreal.
Right.
We suspected an overdose, but we couldn't figure out the substance. We started with basic life support, making sure he was breathing and getting oxygen.
Okay.
Then while transporting him, we noticed a small surgical scar on the head.
Wait a surgical.
There are police reported ahead.
He recently had his appendix removed.
Oh.
We realized he might be reacting badly to one of his prescribed medications.
So the scar was like a hidden message pointing you in the right direction?
Exactly. Yeah. And it highlights just how important observation is in these cases.
It's like solving a medical mystery. Did the patient recover?
He did. Once we relayed this information to the hospital, they were able to provide targeted treatment. It was a great reminder of how vital communication is between paramedics and hospital staff.
It's amazing how these seemingly small details can make such a big difference. Okay, so we've talked about the science, the assessments, and the treatments, but I think we need to address the elephant in the room,
Yeah,
the opioid crisis.
you're absolutely right. It's a major public health crisis, and it's something we can't ignore.
Exactly. So let's talk about fentanyl. It seems to be at the center of many of the headlines these days. Why is this particular opioid so dangerous?
Well, for starters, fentanyl is incredibly potent. We're talking 50 to 100 times more potent than morphine.
Whoa, that's scary powerful.
It is. And what makes it even more dangerous is that it's often laced into other drugs,
Oh, wow.
sometimes without the user's knowledge. Someone might think they're taking heroin or a prescription painkiller, but they're actually getting a dose of fentanyl that's potentially lethal.
That's terrifying. It's like playing Russian roulette with your life.
It's a huge problem. Let's go through a scenario involving fentanyl. A young man is found unconscious in his apartment. His friend calls 911 and he's barely breathing.
Sounds like a classic opioid overdose. What did the paramedics do?
They immediately suspected an opioid overdose. They saw the telltale signs: shallow breathing, pinpoint pupils, slow heart rate. They administered naloxone.
Ooh,
But here's the thing. It took multiple doses to revive him
multiple doses. Why was that?
because fentanyl is so potent, it can take a much higher dose of naloxone to counteract its effects.
Oh, wow.
That's why it's crucial to have naloxone readily available and to administer it quickly in suspected fentanyl overdoses.
This is all pretty intense. It's clear that fentanyl is a game changer in the world of toxicological emergencies.
Absolutely. And it highlights the need for greater awareness,
Yeah.
harm reduction strategies, and readily available access to naloxone.
I think you just transitioned us perfectly into the next part of our deep dive.
Okay.
Let's talk more about harm reduction and what it means in the context of substance use.
All right. So harm reduction,
Yeah.
what does that look like in action?
Yeah, it feels like a bit of a controversial topic,
Yeah.
but clearly something needs to change, especially with this fentanyl crisis.
Yeah, harm reduction is really about practicality over judgment. We know substance use exists, and the goal is to minimize the negative consequences that come with it.
Okay.
And it's important to remember harm reduction isn't one size fits all.
Right.
It's about finding the right strategies for different individuals and communities.
So walk me through some examples. What kind of strategies are you talking about?
Well, one that's been around for a while is needle exchange programs.
Okay.
They provide sterile needles to people who inject drugs,
Right.
which directly reduces the risk of transmitting diseases like HIV and hepatitis C.
That makes sense. It's a simple way to prevent a much bigger problem.
Exactly. Another harm reduction strategy that's gained traction is safe consumption sites, sometimes called supervised injection facilities.
I've heard about those. Aren't they kind of controversial?
They can be, yes, but the idea is to provide a safe, hygienic environment for people to use drugs under medical supervision.
Right.
If someone overdoses, there's help immediately available.
So it's kind of like having a safety net there just in case things go wrong.
That's a good way to put it. And it's not just about preventing overdoses. Safe consumption sites also offer an opportunity to connect people with health and social services like addiction treatment or housing support.
So it really is a wraparound type of support system.
Exactly.
It sounds like harm reduction is about meeting people where they are and offering support without judgment.
That's the heart of it. It's about recognizing the humanity of people who use drugs and offering them a pathway to a healthier life.
This all makes sense to me, but I'm sure there are still people who are hesitant about harm reduction. What are some of the common misconceptions or challenges?
The biggest hurdle is often stigma.
Okay,
Some people believe that harm reduction enables or encourages drug use.
but that's not the goal at all, right? It's about minimizing harm, not promoting drug use.
Exactly. It's about shifting the focus from judgment to compassion and recognizing that addiction is a complex health issue, not a moral failing.
I think sometimes we forget that people who use drugs are just they have their own stories, their own struggles, and they deserve support and understanding.
Absolutely.
Walter
We
White.
need to have more open and honest conversations about substance use in our society. We need to move beyond fear and prejudice and embrace evidence-based approaches that prioritize health and well-being.
Well, I think we've covered an incredible amount of ground in this deep dive.
We have.
We've explored the science behind toxicological emergencies, we've examined real-life scenarios, and we've even delved into the complexities of the opioid crisis and harm reduction.
And how paramedics and medical professionals respond, and how important it is to have a multifaceted approach to addressing substance use in our communities.
Listeners, as we wrap up this episode, I want to leave you with this thought. Substance use and abuse are complex challenges, and there are no easy solutions. But by fostering understanding, embracing compassion, and supporting harm reduction initiatives, we can create a safer and more supportive environment for everyone.
Thank you for joining us on this deep dive. Stay curious, stay informed, and most importantly, stay compassionate.
So we're talking harm reduction. What does that look like in action? It feels like a bit of a controversial topic,
Yeah.
but clearly something needs to change, especially with this fentanyl crisis.
Yeah, harm reduction is really about practicality over judgment.
Okay.
We know substance use exists, and the goal is to minimize the negative consequences that come with it.
Right.
And it's important to remember, harm reduction isn't one size fits all. It's about finding the right strategies for different individuals and communities.
So walk me through some examples. What kind of strategies are we talking about?
Well, one that's been around for a while is needle exchange programs.
Okay.
They provide sterile needles to people who inject drugs,
Right.
which directly reduces the risk of transmitting diseases like HIV and hepatitis C.
That makes sense. It's a simple way to prevent a much bigger problem.
Exactly. Another harm reduction strategy that's gained traction is safe consumption sites, sometimes called supervised injection facilities.
I've heard about those. Aren't they kind of controversial?
They can be, yes. But the idea is to provide a safe, hygienic environment for people to use drugs under medical supervision.
Right.
If someone overdoses, there's help immediately available.
So it's kind of like having a safety net there just in case things go wrong.
That's a good way to put it. And it's not just about preventing overdoses. Safe consumption sites also offer an opportunity to connect people with health and social services, like addiction treatment or housing support.
So it really is a wraparound type of support system.
Exactly.
It sounds like harm reduction is about meeting people where they are and offering support without judgment.
That's the heart of it. It's about recognizing the humanity of people who use drugs and offering them a pathway to a healthier life.
This all makes sense to me, but I'm sure there are still people who are hesitant about harm reduction. What are some of the common misconceptions or challenges?
The biggest hurdle is often stigma.
Okay,
In 300 meters, turn right onto Worthington Street.
but that's not the goal at all, right? It's about minimizing harm, not promoting drug use.
Exactly. It's about shifting the focus from judgment to compassion and recognizing that addiction is a complex health issue, not a moral failing.
I think sometimes we forget that people who use
Turn
drugs
right
are
onto
just
Worthington
that,
Street.
people. They have their own stories, their own struggles, and they deserve support and understanding.
Absolutely. We need to have more open and honest conversations about substance use in our society. We need to move beyond fear and prejudice and embrace evidence-based approaches that prioritize health and well-being.
Well, I think we've covered an incredible amount of ground in this deep dive. We've explored the science behind toxicological emergencies.
In 200 meters, your
examined
destination
real-life
will be on the right.
scenarios, and we've even delved into the complexities of the opioid crisis and harm reduction.
Yeah, it's been quite a journey.
Thanks for walking us through all of this. It's so important for people to have this knowledge and to feel empowered to act if they ever encounter a situation like one of those.
Your destination is on the right.
Knowledge is power. And remember, folks, if you or someone you know is struggling with substance use, there are resources available. Don't hesitate to reach out for help.
That's right. There's no shame in seeking support. And to our listeners, thank you for joining us on this deep dive into the world of toxicology and substance abuse. We'll see you next time.
Stay safe, everyone.
Jerry!
All right, everyone, get ready for a deep dive you asked for. We're going deep into thoracic trauma.
Oh, buckle up.
You send over medical textbooks, case studies. So we're not messing around. We're going beyond the basics here.
Absolutely.
And you know what's really got my attention? Thoracic trauma. It's on the rise.
It is.
And not just for the reasons you might think.
Yeah.
Of course, car accidents always a factor, but we're also seeing an increase because of rising crime rates,
That's right.
which means in these situations, those first few minutes,
Situations.
absolutely crucial.
Yeah.
Absolutely
Quick,
crucial.
accurate assessment, really key for paramedics.
Really key. Really key, really key. Aqua like it's... Whoa.